Equity, Diversity, and Inclusion that Dr. Henry Tong leads, convened an all-day symposium entitled The Humanitarian Crisis of the US-Mexico Border, a deeper dive from diverse lenses, which was very well attended and with great participation of content experts. Last year's symposium was, to a great extent, the inspiration for this three-part symposium. Today is the third of a three-part series on the very relevant and timely topic of trauma-informed care and services for immigrant families. As I mentioned, the interest generated by this topic, as measured by those registered, has been just remarkable. I want to thank all of the many people who have contributed to bringing this event to you today. There was a lot of detail, behind the scene work and effort to make this possible. Thank you to our CRHD and the California Healthcare Foundation teams. Before we begin, I'm eager to start today's program. We have a strong program. I want to review a few housekeeping items. Some of the housekeeping items are just please be aware that we are recording this session. All attendees are muted and cannot use their cameras. These functions are limited to the speakers only. We have an interactive activity, a brief poll. Please participate when the time comes for the poll. Your answers will be very helpful for us and for planning possible future symposia. Closed caption is active. If you have technical difficulties, please send a message in the questions and answers function to the CRHD JD. Type both your questions and comments in the Zoom chat, and we encourage you all to use the chat function to connect with us and one another and add resources you would like to share. This has been tremendously helpful to have these resources in part 1 and part 2. If anyone is believed to misuse the chat function, you may be removed from the session. After the session, on our CRHD website, we will post a recording to the session and the panelists' slide decks. The Q&As and resources will be added at a later time. Finally, please be advised that some content discussed and or shown in this session may be disturbing or upsetting. Allow me to review very quickly how we have organized today's session. We started by reviewing housekeeping items. We will move on to hear opening remarks. Then our moderator will provide a recap of parts 1 and 2. This will be followed by panelists' presentations. Then we will take a quick break, during which time we will post an anonymous poll. After the break, we will have a moderated discussion with our panelists. Some of the topics and questions posted at the time of registration will be addressed during this discussion. This will also include an open Q&A session. This is your time as attendees to post questions for the speakers. Please use the chat function to post questions to the speakers, and we welcome your questions and your comments and your resources. We will end today with today's session with closing remarks and a few reminders. Now, I'm truly delighted to have Dr. Toll provide the welcome message. Dr. Toll's bio is included in the program, so I'll try to be brief. Dr. Renetta Garrison Toll is the Vice Chancellor of Diversity, Equity, and Inclusion at the University of California, Davis. She previously served as Associate Vice Provost for Strategic Initiatives at the University of Maryland, Baltimore County. And before joining UC Davis in 2019, and we are so fortunate and blessed that she joined us, Dr. Toll was Associate Vice Provost for Strategic Initiatives at the University of Maryland at Baltimore, in Baltimore County, and professor of the practice in UMBC's College of Engineering and IT. Dr. Toll is the founding director and co-principal investigator for the 12th Institution National Science Foundation, University of Maryland's PROMIS AGEP, and co-director and co-PI of the NSF, USM's Louis Stokes Alliance for Minority Participation. And Dr. Toll is an international speaker on global diversity in STEM. She has led discussions around the world on topics such as inclusive engagement, engineering for all, cultivating inclusive excellence within science, engineering, and technology. Her excellent work has been recognized with multiple awards, including the 2016 ABET Claire Felbinger Award for Diversity. Dr. Toll?
Thank you very much, Dr. Aguilar-Gaxiola. It's a pleasure to be with you this afternoon. Thanks to all of you for coming. And I must take just a minute to congratulate Dr. Sergio Aguilar-Gaxiola on his wonderful award this past weekend. He was awarded with the Otley Award, a prestigious award given by the Mexican government. And so I'm sure that virtually you are celebrating him and giving him a warm applause for winning such a wonderful award. Congratulations again to you, sir. It's my pleasure to be here to welcome you on behalf of this really great symposium. This is part 3 of the symposium, Trauma-Informed Care and Services for Immigrant Families, Financial Impacts and Policy Solutions for Trauma. And I've heard that the first 2 were really fantastic. I'm really looking forward to sharing just in my opening remarks how UC Davis is supporting immigrant communities at the institutional level and how we're committed to this work. So earlier this summer on July 20th, we had a joint statement from the Division of Student Affairs and the Office of Diversity, Equity, and Inclusion titled Solidarity with the Undocumented Community. And some of the things that we said in this statement are as follows: to express our collective support for our undocumented community at UC Davis and beyond. We center their humanity and acknowledge the continued strength and fortitude demonstrated despite facing numerous barriers, including unjust and inhumane immigration policies. We remain committed to advocacy and supporting our undocumented community through our words and action. We were expressing also our disappointment because there were new attempts to undermine the DACA program that was announced by the Department of Homeland Security. But we also said that UC Davis and higher education at large were challenged in cultivating the talents of our state, our country, and the world when we do not provide all students an equal opportunity to succeed. And we wanted to express that UC Davis will not stop advocating and living out our values through our service. Dr. Pablo Reguerin is our Vice Chancellor for Student Affairs and was a big part of that joint statement. We also have colleagues and students at our AB 540 and Undocumented Student Center, and we have the UC Immigrant Legal Services Center, and they're continuing to do outstanding work. We encourage students and their immediate family members seeking immigration legal services for initial or renewal DACA applications to contact this group. That's the UC Immigrant Legal Services Center, or UCIMM. We also encourage continually enrolled undocumented students to reach out to the AB 540 and Undocumented Student Services Center because it serves the entire undocumented community with financial resources, holistic advising, connections to immigrant-focused mental health professionals, and much, much more. In addition, we have the Community Advising Network, the Community Housing Listing, our Educational Opportunity Program, our SPEAK program, Student Health and Counseling Services, and free immigrant consultations that are provided. And so I thank you again for coming, for being part of this virtual symposium. I also thank our panelists and participants. And again, thank you to the Center for Reducing Health Disparities for their excellent work. So happy to be here. And I turn it back over to you, Dr. Aguilar-Gaxiola.
Well, thank you so much for those inspiring words and for being a part of this program. We greatly appreciate your leadership. Well, I want now to welcome and introduce Kara Carter, and it is my honor and pleasure to do so. Ms. Carter's bio is also included in your program, so I'm going to try to be brief. Ms. Carter is Senior Vice President of Strategy and Programs at the California Healthcare Foundation, where she develops strategies, provides overall guidance, and leads the program teams in the development, execution, and assessment of the foundation's work. In this role, Kara provides thought leadership and support to the foundation's grant-making programs and priorities, as well as the program-related investments and learning and impact functions. She's a national and state leader and recognized champion for improving access to care for underserved populations. Very briefly, prior to joining the foundation, Kara Carter was a partner at McKinsey & Company's San Francisco and London offices. She was a leader in McKinsey's Medicaid practice in the US and supported public and private sector health systems in the US, UK, and Europe to improve quality, access, and affordability. In her bio, you will see the solid training that Kara Carter has. And I can add, on a personal level, because I have been really delighted to know her work, that she's very thoughtful, a brilliant strategist, a team player, and deeply committed to better the lives of those with health needs. Welcome, Kara.
Thank you, Sergio. That was almost blush-worthy as an introduction. Good afternoon, everybody. I am absolutely delighted to be here with you all today, and I'm especially excited to learn from our speakers as the afternoon progresses. Before we get started, I was going to take a moment to thank Dr. Aguilar-Gaxiola for the invitation, as well as for his lifelong deep commitment and service to immigrant populations. As Dr. Tull noted, was recently recognized with the Otley Award, which for folks who don't know, is the government of Mexico's highest recognition to individuals who have positively affected Mexicans abroad. As Dr. Tull also noted in her welcome, this is the third and final installment in a three-part symposium, which began earlier in the summer with an introduction to the policies that are creating an epidemic of trauma in immigrant communities. The second part took a deeper look at how those policies impact people on an individual or human level, and the types of trauma-informed interventions that can be deployed to support individuals and families. Today, we're going to take a look at how this trauma manifests on a population level, and the impact that it can have on entire systems and the economy, as well as the kind of system-wide solutions that are most likely to be effective in response. I'm very much looking forward to what our distinguished panel of speakers have to tell us about these system-wide problems and solutions as they relate specifically to families experiencing trauma as a result of anti-immigrant policies. Before we do that, I wanted to take just a moment to put today's conversation into the context of what we know about the impact of trauma at a broader level. Untreated trauma is a major contributor to some of the greatest social challenges in the country, and indeed in California, and it puts a huge burden on our public systems. Let's start with healthcare. So if folks don't know, healthcare is the single biggest line item in the California state budget. And the most recent data available, which dates back to 2013, the health-related costs of adverse childhood experiences in the state of California totaled over $10.5 billion per year. Yes, I said $10.5 billion. And the total costs that we can see beyond the healthcare were estimated at over $100 billion. It would be wrong for me to pursue without noting that mental health is particularly important in an economic context. Every extra poor mental health day in a single month is associated with over $50 billion in lost earnings nationally. Every single day. That makes mental health one of the costliest forms of illness in the nation. And it's also worth noting that adverse childhood experiences are not just linked to healthcare costs. They're also linked to many of the biggest challenges facing our society. Homelessness, poverty, interactions with the criminal justice system, all of which are positively correlated with childhood trauma, and all of which create real costs to individuals, families, and to the social infrastructure that we all depend on to thrive. At the human level, while the impact on an individual is staggering enough, I wish I could say that it stops there. Sadly, we know that parents who have experienced childhood trauma are therefore more likely to find themselves unemployed, living in poverty, or convicted of a crime, are more likely to raise children who grow into adults with the same experiences. The kind of trauma that we are seeing in immigrant families in 2020 is driving an intergenerational debt that our children, and indeed our grandchildren, will be paying for time to come. There has to be a better way. We have to be able to imagine and implement systems to prevent harm and to promote healing. Money is not the problem here. We throw plenty of it at symptoms. And it's time to put the emphasis where it needs to be, on solutions. This is true generally in California, and it's especially true when it comes to dealing with the impact of trauma on immigrant families. I was happy to learn this week that in a 2020 scan of foundations by Grantmakers in Health, 87% reported investing in trauma and resilience efforts. I'm looking forward to learning more about the economic impact of adverse childhood experiences on immigrant populations today, as well as the challenges that are presented by the federal landscape in which we are operating. And mostly, I'm looking forward to the ways to learn about how California is responding. So with that, and with great gratitude for being here, I'll hand back to Dr. Aguilar-Gaxiola to get us started. Thank you.
Well, thank you so much, Cara, for those excellent words and information. And we are very much looking forward to your closing remarks as well. Appreciate it.
Thank you.
Now, I'm truly, truly delighted to introduce Ignatius Bao, who is our moderator and for today's fantastic panel. And Ignatius has also been the moderator for parts 1 and 2 and has done a fantastic job. Ignatius is an independent consultant working with funders, health departments, and community-based organizations on both immigration and health policy issues. He worked for 10 years as an immigration attorney at the Lawyers Committee for Civil Rights of the San Francisco Bay Area and was the founding board chairperson of the Northern California Coalition for Immigrant and Refugee Rights. He helped draft the 1989 San Francisco City of Refuge or Sanctuary Ordinance and was on the statewide steering committee of Californians United Against Proposition 187. He will start off by introducing 3 clips that we have prepared for you. He will then provide a recap of parts 1 and part 2 of the symposium, and he will finally moderate our excellent panel for today's session. Ignatius, you have been such a wonderful partner all along in this symposium, and I really appreciate and publicly wanted to to say that. Ignatius?
Thank you, Dr. Aguilar-Gaxiola. So as was mentioned, we're going to start with 3 brief video clips just to set the context for our conversation, really focusing on what we all can do as folks living here in the United States against some of these policies that are creating trauma in our immigrant communities. So that just gave us an indication of the kinds of responses to these policies, and we'll have much more discussion about that as we go to our panel. But I just wanted to take a few minutes for those who may not have participated in parts 1 and 2 to briefly review what some of the panelists and speakers were able to share with us in the earlier parts of the symposium. So we began part 1 with a great keynote from Dr. Dimitris Papadimitriou, who is one of the founders of the Migration Policy Institute. And what he shared with us was that there have been over 400 separate administrative actions by the Trump administration against immigrants and refugees, which is an unprecedented remaking of our immigration law and policy. And so some of that we know about, that particularly our first panelist, Dr. Luis Zayas from the University of Texas at Austin, really highlighted the family separation policies and how that really is a form of adverse childhood experience and trauma in its most severe form, and how that kind of separation really impacts not only the children, but their parents and the entire community in terms of the kind of traumatic experience that has had. And Dr. Zayas then pointed out some of the responses that providers could have in both providing mental health services, but also really providing other kinds of social support for the families who had experienced this horrible separation. Our next speaker, Samantha Artiga from the Kaiser Family Foundation, then gave us an overview of how some other policies beyond family separation, the public charge policy, many other policies impacting benefits, also impact immigrant families. She shared how some of the qualitative work that the Kaiser Family Foundation has done has demonstrated the fear and uncertainty that these families are facing, and that they're decreasing the use of programs and services because of those fears. Our third speaker in part 1 then was Mayra Alvarez from the Children's Partnership, who then shared specifically some data from California of how this impact has had the trauma in California immigrant families. Focus groups that the Children's Partnership had done have also reinforced and built additional evidence of this kind of trauma here in California. And then finally, Ms. Alvarez ended with some of her recommendations on how we could support children, again, through these experiences of trauma. In part 2, we were honored to have a keynote from our first California Surgeon General, Dr. Nadine Burke-Harris. And Dr. Burke-Harris has devoted her life and her career to documenting the impact of adverse childhood experiences on the health of the children, their families, and our community, and some of the costs, which we'll also discuss later on today. And so Dr. Burke-Harris really set that groundwork for the work that she has done her entire career, and how important trauma from incarceration, from immigration, deportation, from detention even, is also an equally important type of trauma that we should be considering. Our panelists then for part 2 really focused on how providers could be responding to this trauma. So Dr. Andres Sciola from University of California, Davis, talked about some of the clinical approaches of providing trauma-informed care, and really talked about the response as resilience, not just individual resilience, but the resilience of families and of communities and of society as a whole. and how there are steps that individual providers can take, both as practitioners, but also within their organizations and their institutions to address this trauma. Our second speaker in part 3 was Dr. Tu Quach from Asian Health Services, who talked about the particular trauma that the Asian American community has additionally undergone because of COVID-19, the anti-Asian attacks by blaming COVID on Asian Americans or Chinese, the disparate economic impact early on Chinese restaurants in Chinatown. And so as a community health center, Asian Health Services quickly adapted, like other healthcare providers, to move to telehealth to try to continue to serve their patients, but quickly realized they also needed to enter directly into testing the community and making sure that the community had information about COVID itself. And so they launched, just before our symposium panel, their own community testing site and have provided that multilingual, multicultural service to their communities. And then finally, our third panelist in part 2 was Dr. Altaf Sadi from Massachusetts General Hospital. And Dr. Sadi really described this broader global framework, how trauma really begins in home countries before immigrants even migrate or refugees have to flee. The trauma happens during transit on the way to the United States, and then the types of trauma that we've seen documented in detention and in the deportation process. And so what Dr. Sadi has done is work with healthcare systems and healthcare providers to show how those systems and providers can reduce the risk of trauma and really build what she calls immigration-informed services that are not just trauma-informed, but really take into account the complexities of immigration and immigration law. So with that, it's really my pleasure now to turn to our panelists for today. Our first panelist is Dr. Jeffrey Hotch from the University of California, Davis. Dr. Hotch is an expert in thinking about how we use economics as a health economist to inform our policy and our practice. And so Dr. Hotch will talk a little bit about the financial impacts of trauma and how we can use that data in thinking about policy solutions. Dr. Hotch.
Good afternoon, everyone. It's my pleasure to have the opportunity to speak with you a little bit about cost and cost analysis. And I want to ask you to consider who was the person who said, "I want to learn more about costs." If you guessed no one, then you're right. But I promise you, as a health economist and a professor at UC Davis, I'm going to try very hard to share with you why I think some research on costs could be very helpful in trying to help you be more successful in obtaining what you want to obtain. So that's what we're going to be talking about next. I'm going to lay out in particular the 3 areas we're going to cover. We're going to be talking about how you can use cost research to make the case for a problem. We'll be talking about how we can use cost research to actually advocate for a solution. And last but not least, we'll be talking about how you can use cost research to actually show the value of what you're doing and potentially protect it from those who may not believe they should be investing in such things. So I'm going to start next by asking you to think about why costs. Well, costs, you can see on the bottom right of this slide, produce what we call a burning platform. And you might say, why do we need a burning platform? How does that focus attention? Well, the quote on the left explains, if your house is burning, wouldn't you try to put out the fire? So it's possible that calculating the costs related to some particular issue may actually help focus people on the fire that's burning. In addition to which, maybe it's not your house in flames. Maybe it's the neighbors next door. So that's also really important to you, or it should be, because if your property's on fire, you get it. But if it's your neighbor's house or property that's on fire, then you know soon enough yours is going to be in danger as well. And cost analysis helps us understand that there is a burning platform and that we must do something about it. And next, I'm going to be talking about why costs, right? I mean, costs show the burning platform, but what advantage do they have? So here's a slide where you can see many, many bad things that may be happening related to trauma. You might have adverse childhood experiences, or ACE, and you can see that at the bottom of the pyramid, but that leads to bad things like impairment or risky behaviors, or disease, disability, and social problems, and even early death. So there's a lot of bad problems. If there were a way to summarize it all in one number, it might be a more efficient way of talking about the burden of this, or the total burden that this actually puts to not only people themselves, but also to society. And this way of taking all the bad things and summarizing it in a number, this is what you can use cost for. You can summarize all the bad in a number and call it cost, and then be able to say, we lost this much money because of this. Trauma is responsible for this much lost. And it summarizes everything all at once. So this is part of the appeal of using costs. And I'm about to give you an example of how people can do that with costs in trauma. That's coming up next. So in the example we have here, I like to call 10.5 billion reasons to care. So this is an article that Kara Carter made reference to, and we've heard about the Surgeon General in California as well. She's the senior author. The article is called Adult Human Burden and Costs in California during 2013. So it's during 1 year. And what's it related to? What's causing this? Well, it's being caused by prior adverse childhood experiences. This is the ACE stuff we were talking about. Now, her estimates based on numbers are that among adults in California, 3/5, or about 60% report ACEs, or adverse childhood experiences. So 3 out of every 5. Now, who cares? Well, those ACEs are associated with $10.5 billion in healthcare spending. This is healthcare spending that didn't need to happen, but because of the ACEs, we have an increase, an excess, if you will. And that's just in 2013. So this is a lot of money. And the idea here is illustrated in the picture on the right. It's not to paint a hopeful portrait. It's not to advocate for the good that your organization is doing. It's to instill panic and say, look, there's a burning platform here. This is something that affects a lot of people, and it costs a lot of money. If you're interested, the article you can see is cited here at the very bottom of the slide. But next, I want to make sure you're clear that when we're talking about costs, it's not just healthcare costs. Here you can see in the CDC's work, the Center for Disease Control and Prevention, they're saying that nearly 2/3 of adults have faced at least one ACE, one adverse childhood experience. And it's easy to see how it's becoming a crisis. So a lot of people are having these experiences, but it's a crisis not only because it affects the individual, both on a mental, a physical, and an emotional level, but it's also a problem because it's affecting society. And here is the issue. Here is the concept of cost perspective. The reason it's affecting society is not just because the person's getting the cost, but it also is permeating through other areas. You can see healthcare. It looks like it's a 25 billion. You can see that bar right there, but the total is 124 billion. So what does that mean? That means about 1 out of every $5 is being spent on healthcare. But there's still $100 billion of cost that's related to this. There are costs that fall on the criminal justice system, on child welfare, special education. Look at the productivity loss. It's gigantic. It's huge. That's more than all of the other categories. And that's not a healthcare thing. That's a workplace thing. That's why it should be important to people, because it's going to affect not only the healthcare segment, but it's going to affect the economy and all of us as well. So next, we're going to see a case being made actually in the workplace. This is taking a look at the impacts of ACEs, that's the adverse childhood experiences, on the workforce. So we're comparing employees who have no adverse childhood experiences, and we're comparing them to employees who have ACE scores of 4 or higher. So the ones that have more adverse childhood experiences are more likely to report serious financial problems. They're more likely to be absentee at their jobs, and they're more likely to have serious job problems. So this means that not only is the person suffering, but also the economy and the business will be suffering as well. So business is being affected, and you can see how we're able potentially to knit together stakeholders if we did the work to look at costs and see the different perspectives and see how it's really affecting all of us. And this leads Dr. Block to be saying, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. So that's ACEs for everyone, right? Let's see how it looks next for immigrants. So what we know so far is that trauma has multiple impacts with multiple costs, and these impacts are going to be to different sectors, and they're going to be through different time periods. Now, I want you to do the following thought experiment. Just think about it. If you're thinking about immigrants, do you think it's going to be more or less likely for them to have experienced trauma? Remember, the previous analysis, the previous research was about everyone. For the group of immigrants, do you think more or less likely to have trauma? Do you think that trauma is going to be more or less severe? And do you think immigrants are going to have more or less resources to cope? So think about that. If you think that trauma is a problem just looking at costs, just looking overall, remember 3 out of 5 people have ACEs and they're associated with this giant cost, then it's possible that for immigrants, this is going to be an even bigger problem and perhaps worthy of more attention. If you thought it was important overall, it might be really important for this group. And next, we're going to see what we might do after we've used costs to perhaps calculate a cost of illness or a burden of disease. This sparks interest. And now decision makers or policymakers want to know, what should we do? Everyone comes to those decision makers and policymakers with problems. Why is yours special? Oh, it costs a lot, but what should we do? Let's see what we can do next to try to make that case. So you might go to literature, you might look around, you might actually have knowledge of different ways to screen for trauma or treat trauma, or maybe even find a way to maintain people as they are coping with trauma. But what should you do first? Next, we take a look at if you have multiple choices, like should you invest in prevention, or maybe treating people with trauma, or maybe maintaining people who have been treated and are doing well now, but if we don't maintain them, it could be a setback. So if you can pick what you want to do you know for whom you want to do it? Do you want to look at the elderly, the adults, the kids? Now, why do you have to choose? Well, you've got scarce resources. That's what the health economists tell you. Scarce resources means you have to choose. So let's say you're going to choose kids, and let's say you're going to work on prevention. Great. The decision maker, the policy maker, the person in charge wants to know, what should I do? Should we do program M or program N? Oftentimes people might look at which is maybe more effective, or you might think I'm here to tell you about costs, so I'll tell you look at the costs. But the way to make smart shopping decisions is to look at both the extra cost and the extra effect. You want to look at what you get and what it costs. And oftentimes, because people haven't done a lot of collecting of the data, we have to make models. So next, I'd like to tell you about the models we work with. Oh, Sergio, did you put this in? These are not the models we work with. Sorry. Next, you'll see what models I'm talking about. You've got maybe time on the horizontal. That's talking about like yesterday, today, and the future. And then you've got the thing you're maybe interested in on the vertical. In this case, it looks like it's number of husbands. And you can see in the cartoon, it says, the researcher saying, as you can see, by late next month, you'll have 4 dozen husbands. Better get a bulk rate on wedding cake. So we can come up with really helpful advice when we make these models. And next, you can see how sometimes when you're looking at something, it may look different. But when you do the research and you study exactly what's the outcome we expect, sometimes things that look different are actually the same. They produce pretty similar results. So you might also want to look at the costs to compare. Are you paying a whole lot more for something that's basically the same? Or maybe you're only paying a little bit more for something that's hugely different. So this is why people do these studies and publish these studies. And on the next slide, you can see a review of these studies. Let me share with you what the review found. This was a review for trauma-informed care for adults involved in the correctional system. It was a review of the cost effectiveness studies, and let me summarize what they found. And I quote, "No relevant studies were reported on the cost effectiveness." Yikes. Okay, so at least in this group, it wasn't possible to find any research showing the value of doing one thing over the other. I believe you will be in a stronger position if you are able to argue the value. It punctuates the value of what you believe in. And on the next slide, I will remind you that this punctuation of value happens in a lot of different areas. Frequently, it happens with drugs. So the decision makers trying to figure out whether they should fund a new drug or not, and the drug company might punctuate the value by saying, here's the extra cost and here's the extra effect. And the academics will get together and do their academic stuff. But at the end of the day, the decision maker needs to decide, is the extra cost worth the extra effect? And if you haven't done the research to demonstrate the extra effect, then all they're focused on is the extra cost. So next you can see punctuation is important. Don't take it from me, take it from Rachel Ray. Rachel Ray finds inspiration in cooking her family and her dog. Punctuation is important. Remember to punctuate the value proposition of the thing you believe in. Next, you'll see how you can quickly do this. So here you can see two programs. One is the pink jelly bean. The other is the white marshmallow. You can see on the horizontal axis, you've got patient outcome. Clearly, the white marshmallow is better. You can see more, just a little bit more, but you can see more outcome. But that's only part of the story when you're shopping. Next, you'll see that if you consider cost as well, then next, when you actually compare what you get with what it costs, you can see the white marshmallow is way more expensive. And if you draw a line next from the jelly bean to the marshmallow, you can see it's super steep. That means there's a lot of extra cost and very little extra outcome. This is not a good way to spend money, especially if you don't have a lot of it. If you do have a lot of it, contact me after this talk. My contact information is at the end. So cost effectiveness analysis is just the science of doing connect the dots. You get the dots, you connect the line. If it's steep, that means a lot of extra cost for not much extra outcome. If it's flat, that means you don't have to pay that much and you sure get a lot. So next you'll see how this might look on a summary slide where you say, hey, this is the extra cost and the extra effect. If you then throw a dart next and it hits, it shows you, oh, we're in the area where we've got extra effect and we've got extra cost. So that's great. But how do you know if it's like a good amount of extra effect and extra cost? Next, if you draw that line from the origin, you can see the slope. And next, if you compare it to the slide we saw previously, see how that previous slide had that super steep line and this one's kind of flat? This is what case you want to make, that we have a little bit of extra cost and that's okay, but we're getting a whole lot of extra effect. And when the decision maker makes her decision next, she will need to draw a line that next divides the quadrants. All the things underneath the line are considered good value for money. They're worth it. And next you can plot your dot and say, oh, look, next it looks like it's more costly and more effective. Can you see the dot? That's your data. It's underneath the line. The line was the decision maker's values. The dot is your data. Sometimes though, your dot next will fall above the line. And in that case, even though you're more effective, the decision maker doesn't think it's worth it. But if you happen to next have a dot that's underneath the line, then that green thing is cost effective. So the story here in a nutshell is your data produces the dot and the decision maker produces the line. And if the dot's underneath the line, it's worth it. There are many ways to get a dot that is not underneath the line. But we don't have time for that for right now. I just want you to understand the arbitrary nature. The data will give you the dot. The arbitrary political part is where you draw the line. And next, I will remind you that cost effectiveness analysis is just the art of smart shopping. You want to create something that conveys how much better it is, and you want to answer the question, how much more it will cost. And next, we're going to say, hey, it looks like we talked about costs to talk about a problem, and it looks like we've talked about costs as helping inform whether a solution's cost effective. You'll look at the effect and the extra cost. The third thing I want to remind you of before I conclude is the last step, which is going to show up next. And that's after you've talked about how bad something is by computing that total cost, burden of illness, cost of disease. And after you've done a search, perhaps through the literature, or talked with other clinicians or other service providers about what can you do. And after maybe you've made a model or actually run the numbers to see, is this good value for money? What do we expect the extra cost to be? And what do we expect the extra effect to be? There's something you absolutely must do, and it's something many people forget. And that's that last part over on the far right here. That's real world evaluation. Because let's say you do get the money to run your program. You need to protect it by analyzing the actual value. You need to find a way to evaluate it so you can comment on the real world cost effectiveness. In the real world, this is a good use of resources. And if you're unable to do that research, then you are unable to make the case for the value of what you do. So I want to talk just a little bit about that. We're going to visit the real world next. This is the real world. Whoa. So the real world's important because it's not happening in a controlled environment. And a decision maker might have thought, I'm going to fund this, but then she's wondering, how does this really work? So you collecting data in the real world can say, with real people and real providers and real institutions, this is what we're seeing. We're seeing this extra cost and this extra outcome in the real world. And this is important because you are also, while you're thinking about doing this type of study, you're thinking about what is the outcome we really care about? What is success for this group? And which cost perspective should we look at? And who is actually winning and losing with this? Because potentially, maybe the winners might need to reimburse the losers. So next, I'm going to remind you about what I talked about. Today, I talked about costs as a way of making the case for a problem, as a way of trying to argue for the cost effectiveness of a potential solution, like a new treatment or new intervention. And I also tried to remind you that you might want to think about costs when you're actually doing something, so you can study the actual costs and the actual outcomes and make the case that actually what you're doing is good value for money. And next, I will remind you of my contact information.
Thank you so much, Dr. Hatch. So next, we have Tanya Broder, who is a senior attorney from the National Immigration Law Center, and Tanya's going to give us an overview of federal immigration policy changes, as well as some state and local changes and some solutions as well. Tanya?
Thank you, Ignatius, and good afternoon, everybody. I am going to talk right now about the federal immigration policy changes that we've seen, some of which Dr. Here we go. Hold on. There we go. And I'm going to talk about what we as state and local governments and healthcare and social service providers and community members can do about it. So for an overview of the federal immigration policy changes, I'm going to go through a whole series of different things that the, sorry about this, that this administration has done to restrict immigration to the US. In just over 3.5 years, this administration has imposed hundreds of policies restricting legal immigration to the US, beginning with the Muslim bans that when everyone rushed to the airport to try and oppose it, the refugee admissions that were reduced dramatically, even in the early days of this administration, the dismantling of the asylum system, due process at the border, imposing quotas on immigration judges, the zero tolerance policy that led to family separation and detention of family members, the termination and recently upheld of the temporary protected status program, hundreds of thousands of people who have lived here for decades, and the deferred action for childhood arrivals program that we'll talk about in a bit, attacks on diversity visas and family immigration, restrictions on employment visas, and citing the pandemic as justification, a ban on almost all visas now, an effective end to asylum at the southern border. As the Migration Policy Institute documented, this represents over 400 policy changes. And these sweeping measures were aimed not only at restricting immigration, but at changing the face of the US population. The National Foundation for American Policy projects that legal immigration will have fallen by over 49% between fiscal year 2016 and 2021 due to the Trump administration's policies. In addition to restricting immigration to the US, the administration has also sought to enforce immigration, sought to go after almost everybody who's undocumented in the US, rather than making enforcement priorities. They have engaged in worksite and community raids, in detention, in enforcement at or near sensitive locations like churches, healthcare centers, schools, and in courts. When people are seeking redress from the courts, they're fearing that immigration agents may be there. The administration has targeted activists, sponsors of unaccompanied children, and has even threatened to denaturalize US citizens. There have been attempts to deny funding to localities that sought to limit their engagement with federal immigration enforcement and entanglement with those efforts. And they have even chilled applications for status or relief when someone's eligible for relief. They're fearing that even seeking that relief will land them in removal proceedings. Under this administration, non-criminal arrests by ICE have doubled since 2016. So it's really it's very traumatic. Even where the numbers are low, the numbers of enforcement actions are low, they have served to terrorize immigrant communities and immigrant families. Next, we look at the Deferred Action for Childhood Arrivals program, which in itself was an incredible organizing victory by immigrant youth and their allies that wouldn't take no for an answer and has continued to seek relief not only for themselves, but for their parents and family members and community members. In September of 2017, this administration issued a memo terminating DACA, after which litigation from all over the country was filed, challenging that termination, and with support from researchers and businesses and students and educators, the result was that 2-year renewals for DACA continued, and we've got over 645,000 DACA recipients living in the US as of March 31st of this year. The cases went all the way to the Supreme Court. You saw in the video of the cheering of the immigrant youth who organized and went to the hearing. And actually unlike what the video kind of foretold, the Supreme Court vacated that 2017 memo. A month later, what we call Acting Secretary Chad Wolf issued another memo. Rather than going back to the status quo that existed before the termination of DACA, they have a new memo which effectively doubles the cost of DACA by having 1-year renewals available instead of 2, and not allowing any new applications for DACA right now. The fight is not over. There's a challenges filed all over to the new Wolf memo and even to the validity of Wolf's appointment. So please stay tuned for more of this. One of the things that the Supreme Court recognized was that the DACA program itself has been incredibly successful, allowing immigrants to obtain jobs with health insurance, higher education, buy homes, support their families, and otherwise continue to contribute, even as essential workers providing health care to our communities. The next threat that we've seen was also featured in the video, the public charge ground of inadmissibility. So people who are deemed likely to become a public charge can be denied either entry to the United States or a green card. The Department of Homeland Security and the Department of State have new rules that would make it more difficult for low and moderate income families to immigrate or to get a green card based on a range of different factors considered in the test, like somebody's age and income, their education or skills, even their English language facility, and their credit history. This actually will make it more difficult to immigrate. The other thing that it does is it chills access to benefits, even though most immigrants who face a public charge test are not eligible for the benefits that are counted in the test. And that's very important because really the effect of this rule has gone much more broadly, is being felt much more broadly than the actual immigrants who are affected by a public charge test. And recognizing this, the organizing on this rule has been phenomenal. Over 266,000 comments and lawsuits in 5 different courts were filed, effectively delaying the rule's implementation until February 24th, 2020 this year. And the litigation is not over, it continues. The Department of State rules that govern applications for status and entry abroad. So some people have to leave this country to go to a consular office abroad to get their status. Those rules are currently blocked thanks to litigation. Though during this presentation, the government lawyers have sought to stay that injunction, so stay tuned. And the Department of Homeland Security rules have been allowed to resume while the litigation proceeds. And the USCIS, the Immigration Service, has posted new instructions on those rules just today, so you'll see who it applies to. And please stay tuned for updates. There's a really wonderful kind of coalition of groups that continue to work on public charge, not just to stop the rule, but also to make sure that community members know who's affected and what they can and can't do so that they can seek services with some confidence. Some of what we've talked about is, although the physical wall largely did not materialize, the invisible wall of administrative policies that we've been talking about make it very difficult for low and moderate income families to immigrate, to naturalize, to secure critical services, and deprive immigrant families of the opportunity to thrive and live with dignity. So we've got a range of different policies up here on the wall, some of which have gone into effect or have been challenged. Others are still anticipated. So there are more opportunities for people to weigh in to oppose future rules, all of which work together to try and both limit immigration and limit who is allowed to live and thrive in the US. Next slide. The COVID pandemic layered on top of this has exposed long-standing disparities in access to care, financial support, and safe working conditions that disproportionately harm Black, Indigenous, Latinx, and low-income communities of color, including immigrants. Immigrant families and others were excluded from the federal financial relief, like the stimulus checks and unemployment assistance that's available from states. The good news is that immediately states, localities, private donors, and nonprofit groups stepped up to offer immediate relief. And there were programs all over the country that I'll show you in a later slide, but are now kind of grappling with what's a longer term strategy for trying to raise revenue and address this need while the kind of political forces move forward. The racial justice and criminal justice conversations have also advanced during this pandemic. When we've looked at very dangerous conditions of detention, especially during the COVID crisis, and what are alternatives to investing in recovery. The growing realization is that the recovery from this public health and economic crisis is going to require an investment in the healthcare and economic support for all. We're interconnected. One person's health and economic well-being affects all of us. And so that is one thing that we are going to take from the pandemic. What can we do about it? Cynthia will, on the next slide, we see that Cynthia will address a whole array of inclusive state and local policies that California has taken on and has been kind of a beacon for the rest of the country for policies that promote physical and financial health. including efforts to expand access to healthcare and essential services for immigrants, restore access to driver's licenses, improve access to higher education and professional licenses, strengthen the rights of workers and consumers and tenants, limit the entanglement of local governments in federal immigration enforcement so that people feel comfortable or more comfortable engaging with government agencies and getting what they need and feeling like at least the localities have their back. Important investments in access to counsel, which it exponentially increases the chances that you can get immigration relief and get out of detention. Protecting access to the courts, divesting from mass incarceration, as we talked about, which is very dangerous for individuals who are there, and investing in other policies that help people thrive. Next slide. The responses to COVID on the healthcare front have included at least a dozen states that clarified that testing, diagnosis, vaccine, and treatment of COVID symptoms is covered under their existing emergency Medicaid programs, so that if somebody has restricted Medicaid or Medi-Cal in California, they can get testing and treatment of COVID symptoms. They should also, across the country, be able to get those services through community clinics or public health departments. Advocates have also tried to make sure that especially families with school-age kids have access to nutrition assistance and advocated for extensions to the pandemic EBT program, as well as outreach to make sure that families understand what they are eligible for, what the risks are of getting benefits, and ensure that that any care they get or services are linguistically and culturally accessible. In economic support, this has been a really wonderful development on the next slide, that states, Colorado and California recently extended the earned income tax credit to all people who file with an individual taxpayer ID number, as well as those who file with a social security number. So that's very exciting. And states across the country, even in unexpected places, have established short-term cash or rental assistance programs with some combination of federal, state, or private funds. Much of that kind of assistance was depleted very quickly, just showing us that the need is overwhelming. But it bodes well that there has been this kind of investment and belief in the need to invest in all of us. The next slide shows a series of maps that give us a different picture of our country than we sometimes see, which shows that when states are given a choice about whether to expand healthcare to children or pregnant women, they largely have chosen to do so, or in opening access to higher education and financial aid to students regardless of status. Many states on the map have done that, as well as driver's licenses. Now, even the driver's license map doesn't look quite as green or filled in, but those states represent about 50% of the actually over 50% of the foreign-born individuals. So this shows us that we have a country that, when given choices, might even invest in immigrants in a way that helps address these problems. The next slide shows what health and social service providers can do. And have already led the way. I mean, really, the healthcare providers got us the public charge clarification that we're fighting to restore, showing that documenting the costs of fear. So document the harm of restrictive policies and the benefits of improving access, maybe with some of those economic arguments that the doctor spoke about. Monitor the policies to ensure they're actually implemented properly. Even when we adopt a good policy, sometimes we need to kind of take a look, make sure it works. Educate families about the services they can get. Help ensure that immigration and healthcare policies are responsive to families and public health needs that you know very well. Please address the barriers that prevent families from securing care. And finally, taking all of these good state and local efforts up to the national level. We've got a lot of challenges here, but I think this is the way that we can really bring our commitment to the national stage by supporting inclusive healthcare and economic recovery measures, integrating immigrants into any progressive policy platforms that are being proposed now to protect existing immigration pathways and benefit programs. There's a week of action on temporary protected status this week. There's plenty to do to try and make sure that the public knows what's important. You all can comment on any new regulations, whether as an individual, as a healthcare clinic, as an educational institution, wherever you come from, you can comment on it, or as a state or local government. You can participate in the same way in any litigation, either as an expert, as a friend of the court, or as a party. You could share your expertise and your experience in the media and help envision a new immigration, healthcare, and justice system by collaborating with other states and localities, healthcare and social service providers, community members to make change from the bottom up while on a daily basis improving the lives of all residents. And finally, please help us send the message that investing in the country's residents pays off not only economically and socially, but politically as well. We look forward at the National Immigration Law Center to working with all of you on that. Thank you.
Thanks so much, Tanya, for that overview. A lot to consider, a lot of different policies, both to fight against, but also lots of great solutions that you outlined there. So our third speaker is Cynthia Buiza from the California Immigrant Policy Center, and Cynthia has led, as Executive Director of CIPC, many of the initiatives here in California to secure a more welcoming place for immigrants in California. Cynthia.
Thank you, Ignatius, UC Davis, and everyone for this very timely and important conversation. Before I talk about the system of protection that California has built for immigrants, and Tanya already alluded to some of them earlier, I would like to say a few words about this current moment and the state that California's immigrants are living. Not to mention the fact that they comprise 27% of California's population, because 27% of our population is foreign-born, and over 2 million residents in our state are undocumented immigrants. Yet, they're going through historic, unrelenting, multifaceted crisis compounded by the anti-immigrant policies of the current administration. I always like to say that life was already hard for immigrants in the United States before 2016 election, but it just got infinitely harder for them with the current crisis. And what are the ways in which this is manifested? They're left out of most federal relief packages, even as they perform essential work during this pandemic. They are disproportionately impacted by COVID-19, with the number of Black and Latino immigrants either dying or being infected with the virus, losing homes, and not having sufficient access to healthcare, food, and digital technology. Many existing protections we worked so hard for over the years have been taken away at the federal level by this administration. To date, immigrant children and their families are going through deeply traumatic experiences from family separation policies. Many are still not reunited with their parents, and many are not getting the healthcare that they need, especially in detention. They are also disproportionately impacted by the climate-related crises that's plaguing our state, especially agricultural workers who have to continue working the farms as wildfires rage across California. Overall, many immigrants are still living under a two-tier system in our state, despite California's inroads in creating pro-immigrant policies. But if this is the stark picture that immigrants are living, you are probably wondering, what has the state done to help them? In California, movement building and political power has been critical for immigrant communities. The immigrant justice movement, in coalition with civil rights organizations, farm workers, students, and unions, have won significant gains for all Californians, regardless of immigration status. As a result, landmark policies that expand language access, a statewide legal protective services program called One California, state licensing certification for undocumented lawyers and business owners, as well as state driver's licenses, have been key steps in recognizing the rights of our immigrant residents. There are almost 100 pro-immigrant policies, big and small, that have been enacted in California for the last 20 years since Prop 187. I cannot mention all of them in my presentation, but I will mention a few recent critical policies that my organization and our partners, including the National Immigration Law Center, have worked on that are helping to protect and preserve the well-being of this population. I want to start with a Health for All campaign. California leads the nation in ensuring immigrant access to health coverage insurance and the safety net. One signature campaign that aims to make access possible is the Health for All campaign that was conceived of by a coalition of healthcare and immigrant rights organizations and is co-chaired by CIPC and the Health Access California. This campaign aims to make access possible for many immigrants, regardless of immigration status. We started with the Health for All Kids and have continued with Health for All Young Adults. These are medical expansions that provide state-funded Medicaid coverage to low-income children and young adults through the age of 25, regardless of immigration status. Today, more than 200,000 children are able to access life-saving care because of the Health for All campaign. However, while California has taken important steps to expand immigrant access to healthcare, many are still left out, including seniors or elderly immigrants who needs this access very much today. And we are working hard to ensure that this opportunity becomes accessible to everyone to make sure that our policies are truly inclusive. Next, I want to talk a little bit about economic justice campaigns and how the state has been responsive. We also work in issues that try to improve the economic well-being of immigrant families, from reforming and mainstreaming our workforce development programs to creating an equitable worker justice system in the future of work and the future of workers, especially in our increasingly automized economy. But one campaign that we are very proud of that Tanya alluded to earlier is the California Earned Income Tax Credit. And or we have a short name for it, it's called the CALI ITC. CALI ITC is a refundable tax credit that boosts the income of families and individuals with low earnings from work so they can better afford the basic necessities. CALI ITC helps mitigate California's high cost of living for people who live under poverty and is modeled off the federal EITC, which has been cited as one of the more effective tools for reducing poverty in families. In the past, many people who work were excluded from CALI ITC, including people who use an individual taxpayer identification number. However, recently, through 4 years of advocacy with our partners, the governor signed a proposal to include ITIN filers in the CALI ITC just last week, which will benefit up to 600,000 people, including 200,000 children under the child tax credit. This development is a lifeline for many low-income immigrants who are especially vulnerable to the impacts of the current economic crisis. Now I'm going to talk about what we do to protect immigrants from unjust detentions and deportations. Because California has also enacted policies to prevent local law enforcement from improper ICE holds or immigration and customs enforcement holds, creating transparency between local law enforcement, immigration authorities, and the public, disentangling information and resource sharing between local law enforcement and federal immigration authorities, and making budget investments in legal protective services. However, there is much to be done to ensure that all Californians know and can exercise their rights. In many counties and cities throughout the state, local law enforcement still work directly with ICE and immigration authorities to arrest and deport people in violation of current state law. They find many workarounds in these laws. So the state must do more to ensure that all people know their rights, can exercise their rights, and have access to legal counsel and proper due process. I just want to name some of these policies and laws that are now helping to protect many immigrants who are under fear of detention and deportation. In 2014, the Trust Act was enacted, which limits local jails from holding people solely to begin the deportation process. The Trust Act sets a minimum standard across the state to limit hold requests in certain circumstances. In 2015, CIPC, along with our partners, helped to create the One California program. One California is a state-funded program to support free and qualified education, outreach, and application assistance for immigrants eligible for naturalization or affirmative immigration relief. Since then, the program has expanded to include legal representation for immigrants in deportation proceedings, legal service for deported veterans, and capacity building for immigration services in underserved regions. And every year now, the state allocates somewhere between $45 to $75 million for the continuation of this program. More recently, you probably heard of the California Values Act, which is an act that limits resource sharing and cooperation between immigration enforcement and local law enforcement with limited exceptions. Together, some of these network of policies has helped to protect or limit the exposure of immigrant families in the criminal justice system. But as I said, more needs to be done because as we can imagine, as you can see, and as I pointed out earlier, and you've already seen in the previous iterations of these symposiums, the immigrants in our country and in our state are going through unbelievable amount of strife. I cannot finish my presentation without sharing with you very specifically what is going on with immigrant families under the pandemic. We know now that this pandemic has laid bare even deeper vulnerabilities in immigrant populations. As I said earlier, many immigrants are left out of federal and state relief packages, yet many of them are working on the front lines. But on April 15th, Governor Newsom announced an unprecedented $125 million in disaster relief assistance for working Californians. This first in the nation assistance involves statewide public-private partnership, which provides financial support to undocumented immigrants impacted by COVID-19. California will provide $75 million in disaster relief assistance, and the $50 million will be raised by philanthropic partners. So I would like to round up my presentation with the following call to action. Knowing that we know now about the brokenness of the system we're living in, it is imperative that we work towards a California that will address racial inequities and anti-Blackness in all its forms. What we know now is that our state was built on structures designed to maintain the privilege by intentionally excluding and marginalizing others. It cannot continue if we want to survive as a society and build the California that we want. We also must end the two-tier system for immigrants by making healthcare, education, good jobs, housing, and other essential needs accessible to all immigrants regardless of immigration status. How can we do this? Here are some examples. We need to aspire to build an inclusive economy that prioritizes those who are historically left out and stuck at the bottom of the social strata. We need to create a better universal healthcare system that works and centers communities that have suffered historical neglect, especially Latino and Black immigrant populations. We need to streamline integrated access to health and mental health services regardless of immigration status, especially with what we will see as an epidemic of mental health issues that are going to come up, or is already coming up at the moment, but we will see more stark illustrations of that as the months and years go on. We need to support access to education for all communities, especially those that are impacted by the current digital divide, poor families in underserved regions of California that do not have access to full online learning because they don't have access to Wi-Fi. We need to start treating digital access like it was electricity, something that is now so fundamental to the daily life and daily needs of Californians and of its immigrant populations. I want to close out my presentation by saying that only through a bold and decisive vision based on these principles and the ones that we have heard from the previous panelists will we ensure that we can make the California dream accessible to everyone, not to the few privileged ones, and especially those who have the least among us. With the knowledge that we know now about the consequences of the multi-level crisis we're living, we really can't unknow these things. And this is a call to action to work with us, advocates, state workers, our legislature, and the state government to ensure that we can limit the harm that we have seen caused by inequitable policies throughout the years. I will post my email address and some resources on the chat box so that if you want to know more about our work and access some of the resources that we have online, you can access them. We have a lot of materials that are available in more than 20 languages because we have centered language access as part of our mission. And hopefully we can have a more robust conversation with you later. So thank you again for giving me the opportunity to be part of this conversation. And I'm going to give it back to Ignatius.
Thank you so much, Cynthia. So I would encourage everyone to be thinking about questions for our panelists. We're going to take a 5-minute break, and during the break, we're going to have a poll that we encourage you to fill out, and then we will resume with a moderated discussion with the panelists and hopefully with your questions as well. So please type your questions in the chat, not in the Q&A, and we'll be back in 5 minutes at 1:35. Thanks. So welcome back, everybody. Thank you for those of you who responded to the poll. And as you can tell, many of you have had conversations with community members, other folks around these issues. A good percentage of you, 4 out of 10, have participated in protests. 30% have submitted a public comment, and 27% have reached out to elected officials. We'll be talking about some of these strategies as we engage in conversation with the panelists. So let me start with Dr. Hotch. In your presentation and the study that Cara Carter also cited said there's 10.5 billion reasons to care about trauma and the effect of trauma on Californians, but that just seems like such a huge number. Help us use that number in a way that makes sense to policymakers and decision makers. So within a healthcare system, within a legislature, how do we use a number that big to really describe the importance of really paying attention to trauma?
Thank you very much for asking about that. I think the game has multiple stages. I think the first stage is to try to get attention for your issue. And it may not be important to a particular decision maker, but if you attach a cost, and if that cost is large, then wow, they're going to start to pay attention. The other thing I spoke about in my talk was about perspective. And it's possible that the costs are large, and if they're only in one segment or one area, then it may not resonate so much with the decision maker. But if these are big costs and they're in a variety of different areas, I would imagine a savvy politician would see that he or she could get a lot of leverage out of this, because by acting in this on this issue, it's possible to reduce a lot of costs for a lot of people. So step one of the game is pay attention to me. But step two has to be, once maybe you've got a chance, you've got the opportunity to meet with them, step two has to be, well, what should they do? Like, wow, yeah, everyone, who's in favor of trauma? No one. So but I don't know what to do. What would you recommend we do? Or maybe the things you're asking of me, I don't have the power to do. That's the federal government. That's someone else. But I suspect a specific ask might be a great idea for stage 2. Stage 3 is going to be, no, we can't do it. It costs money. And from my perspective, it's silly, in my opinion, to set the bar so high as to suggest whatever your solution is going to save money. That to me seems an unnecessarily high bar. Another option might be to say, yes, we do need this investment. However, look at what you get as well as what it will cost. So now the discussion is not, will you save money? Now the discussion is this a good use of money? Is this a wise investment? Do we get something? And if so, how much? So the costs, from my perspective, at least in the article I showed, were fantastic for saying, look, there's a lot of burden, and we just measured in dollars, but there's a lot of burdens for this issue. And so you should pay attention. So it's great for step 1. But if you're in the what should I do market, or the how do I show that doing A is better than doing B market, if you're to that next step, you need more than just trauma costs a lot, my perspective.
Great, thank you so much. So a question that came from a participant, I'm going to turn to Tanya. How do we sort of do the other part of that? Oftentimes we say in advocacy, it's both numbers and stories. So how do we also document the harms, the impact of trauma on immigrants? And as providers in particular, how do we do that with confidentiality, with assuring them that we're not going to expose them even more to greater harm? So can you describe some of the ways in which we can share those stories safely and confidentially?
Sure, there's so many ways that healthcare providers have and can continue to document the harm. There's no need to expose people. You don't need to have names. You don't need to have identifiers. And you don't even need to detail what a person's immigration status is if you don't want to ask that question. I never recommend asking more than is necessary and is comfortable in a safe space. So I think we've heard from a lot of healthcare providers about their patients who are pregnant, and just in a general way, what the fear has done to their pregnancy, to their childbirth situation, to everything else. Yeah, people can do this they can, if individuals want to submit their information, they can do that completely anonymously. And there's just a lot of impressionistic and even documented harm that folks have been able to do without compromising their relationship or the safety of their patients.
And particularly on the public charge issue, the Protecting Immigrant Families campaign did a lot of really great examples of ways in which folks could report those kinds of harms that were then used in the litigation. And so Protecting Immigrant Families is a great resource for that. So I'm going to turn to Cynthia. I think consistent with the notion that we heard from earlier panelists, that this is really about resilience. It's about fighting back, obviously, to these policies, but it's also building up the capacity, as you said, to withstand these multi-layered, multi-pronged attacks on immigrant communities. So talk a little bit about the work within immigrant communities themselves. I know you work with a lot of local coalitions, and sometimes that work doesn't get really profiled or highlighted because we're focused on legislation or we're focused on litigation. So talk about the on-the-ground work in immigrant communities themselves.
Great, thank you, Ignatius. One of the best kept secrets of our work is the work that we've been having with 9 regional coalitions across California. And this is an 8-year-old project that CIPC has been engaged in, out of the recognition that so much of the resources, both from philanthropy, but also even from state, has been concentrated in gateway cities like Los Angeles, San Diego, and San Francisco. And it's part of the reason why we initiated it, because we've seen a movement of many immigrant families in the inland regions. So these 9 regional coalitions encompasses Southern California, the Central Coast, the Central Valley, and Northern California. And really what we've seen is the level of deep organizing that has been happening in these areas from very, very under-resourced coalitions. And we saw the potential there of making sure that these coalitions and these networks become their community's first responders. You know, like if you look at it from a health systems angle, you want networks of communities that are already familiar with the conditions that immigrants live in to be available in those places. Because from the experience that we had with DACA, when it was first implemented a few years ago, many people had to brave the risk of taking the train or taking a bus, fearful for their lives because of checkpoints, just to come to Los Angeles and San Francisco to apply for status. If these networks of capacities are available in the regions, you don't expose people to unnecessary harm, especially right now where so much fear because of the chilling effects of these anti-immigration policies are discouraging immigrants from accessing benefits and programs that are actually available to them in California. So that's the kind of, it's just the first step to resilience, I think, is like look closer in your communities, examine what are already the resources that are available there. It's everything from whether it's networks of promotoras, you know, networks of community association that take care of immigrants. Immigrants are very creative, like, you know, we bring these community associations with us wherever we go. And are there local community foundations that are willing to help the programs that you have? Does your county have enough savings that you can advocate for so that they can allocate some of your city and county budgets to some of the, for example, the English access, the language access needs of immigrant populations? So there's just so much that can be done if we examine what's already there rather than available infrastructure, which is necessary. But really, at this time where resources are scarce, you know, the state is reducing the budget of many agencies and organizations. We need to be very creative in working with impacted populations, as long as we're clear that we're also making sure these are safe spaces in which to partner with them.
So, Dr. Hatch, this may be a hard question for you to answer. So I think in the funding world and to some extent in the policy world, we often think about these issues in direct services. So what does an individual immigrant or immigrant family need? Do they need mental health services? Do they need health services? Do they need housing? And I think what Cynthia is talking about is really much more organizational and infrastructure and networks. And those are harder to describe in economic terms, what the value is. It's much easier to say I'm helping 100 people as opposed to I'm building the capacity of this organization. Can you help us with any language in the work that you've done, maybe not on this particular issue, but just in terms of thinking about policy? Is there a way that we can make a stronger argument for the value of this kind of capacity in community, the value of networks, the value of trusted sources of information?
Yes, you're right. So much of what really matters is very difficult to measure. I mean, it's a huge step to be even just able to imagine it or to realize that there's something valuable here. And this is why I think it's so important to draw together a large amount of people into our symphony of folks working on this issue, because everyone will have a different perspective. From my perspective, unless you're really in it, you don't know necessarily even the concept of the value that's being generated. But you talk to the people who are doing this every day and the people who are living through it, they have a gist, a general sense of what works and what doesn't. But because, in my opinion, because of the people you're trying to influence may not have gone on that path, it's very hard for them to imagine what you're talking about. And that's just assuming they're going to take you at face value. If they have beliefs that might not make them inclined to find this a high priority, then the fact that they haven't gone through it and those extra beliefs make it an even harder challenge for you. So this is why, beyond just imagining, oh, this could be a sense, and beyond just telling the story, from my perspective, if we're able to quantify or at least name some of the things that are going on, then we can start to get them organized. So we may not be able to roll it up into one number, but if we can see multiple benefits of involving multiple services in a way that we haven't before, from my perspective, at least it tells us where to look, where we might want to start to collect. You could argue that what we're currently doing is not working, because if it were, we'd have solved this. So that means we're going to have to go somewhere new. And somewhere new is uncomfortable. It means doing things differently. It may even mean putting me out of the business I'm in. So that's why I think thinking about who can win and who can lose is important. And recent work that I've done looking into options for homeless people has convinced me that maybe not always the right way is one organization doing that one thing. You need a group of people who are going to come together. And from an economist, from my perspective, you only get the people coming together, and I'm so sorry I sound so crass, but you only get them coming together if they all think they can win. So if you need someone who's going to lose in your solution by coming together, we need to find a way to make sure that people are able to benefit. Even the ones who have to give and who have to lose, they need to be compensated by the winners. And it could be money, but it could be something else, so that we all see, we all have something to gain. Until, and from my perspective, if it looks like one of those parties is going to lose by this whatever new thing you're going to be doing, they will fight you tooth and nail. So the idea being that we all gain, and the idea being let's find a way to make it work, and then maybe we can even document it, I think puts us on the right track. Even if we can't get the exact perfect numbers, at least we're thinking about what we think the benefit is and who will gain, and how do we make sure that some of those gains are spread to others. There may be many people who don't quite understand all of the gains of what we're trying to do. And by even seeking to try to collect the information, I think might make people aware. So I don't know if I answered your question, but I'm certain I took a long time doing it.
Thank you. So Tanya, I'm going to go to you. One of the polling questions we asked was whether folks had ever submitted public comments, and about 3 in 10 that responded had. So talk to us a little bit about that process and what it entails, and how individuals and organizations can get involved, and why it's important, the public charge example being one of the impact that it had.
Yeah, that was a great example. And what happens in the normal course of things is that an agency that's proposing something to do something will publish that proposal to the public. And the point of it is that the public gives input into what they think about the rule and what it might cost and the harm and the benefits and everything we've been talking about. Now what they like is required to review all of the comments and to take time and to respond to them. It's not required to follow them, but it needs to take them into account in making its decision. So what happened in the public charge context is that, and I've never experienced this while at the nonprofit where I work, is really literally 266,000 individuals or groups spoke out. And in all of the court cases, the vast majority of the comments were recognized as being opposed to the rule for every kind of reason. So we had individual, and folks were amazing at developing microsites. So localized in different languages for different communities where individuals could come forward. And if they weren't comfortable, the provider might submit for them. If they were comfortable, they could submit it under their own name, and everyone had something to say about it. So it was really, really helpful in gathering up public opposition to the rule. So kind of as a political organizing tool to get people to kind of work with each other and build an infrastructure to oppose the rule. And then it was absolutely essential in the cases that were filed to at least delay the rule, if not block it altogether, because the courts looked to the comments and looked to what the agency did. And in many cases said, hey, you didn't really take this into account. You didn't take into account the effect on the public healthcare system of this rule. So it's really useful. I really encourage everyone to do it. The folks, not me, but the folks I work with have made it super easy because it's not always obvious how to do it. Just a click of the button, write in your comments or do whatever you want. We are expecting more bad regulations to come forward. So there'll be chances through the Protecting Immigrant Families campaign at www.protectingimmigrantfamilies.org to weigh in, for example, if there is a public charge ground of deportability rule that comes forward in the coming weeks. We'll definitely need to do this again. So I don't know what I left out.
So Cynthia, again, in your overview of how California really has been an alternate voice and done, tried to put in measures to both block some of these bad policies, but also to develop state solutions. And some of them are policies like the Truth Act and the Values Act in terms of what state and local governments should or should not do. But as you noted in the response to COVID with the disaster relief funds, some of it is money. So talk a little bit about that combination of both policy and money making a difference.
You know, I do want to commend both the state and the philanthropic community here, because in the recent years, especially after the 2016 election, both entities have stepped up, both in creating rapid response mechanisms so that these ongoing emergencies that we have, is resourced. But I think it really now, we are moving in this period of maximizing how much we can push the lever of state-private partnerships, you know, nonprofit and philanthropic and state partnerships, so that we can cover as much ground in this very multi-headed immigration problem that we have. There really is no one-size-fits-all here. You know, there really is the need to embrace how complex it is to create these opportunities for the nearly 2.4, 2.5 million undocumented immigrants and other immigrants living in California. So a very specific example that really, I think, triggered some of these recent partnerships is the One California program, you know, because it didn't exist before, right? But now there's almost a network of 200 direct service and legal service entities that are participating across the state that has really expanded our capacity to provide affirmative legal services, but as well as immigration and naturalization services. And it came out of a conversation between advocates, philanthropy, and the then office of Governor Jerry Brown. So there is a lot of room for experimenting, pushing, and bold visioning around what is it still that we can do, especially now that the problems that have been laid bare by so many of the crises we're living are pretty clear. I mean, but that means that the response has to be proportionate, based on resources, based on capacity, based on commitment and political will, but also in making sure that it's accountable, right? Like all of these 4 factors should exist in how we think about what are the new ways in which we could partner with each other, especially with the state, in problem solving a lot of the challenges that California's immigrants are facing in relation to the broader problems that California is facing.
So Jeff, let me go back to you. And what really struck me about the data was, while we think about the direct healthcare costs, and there's clearly some healthcare costs from the ACEs studies, that the overwhelming majority of those costs were lost economic productivity. And so, as you noted in your overview, this is something that business communities should care about. This is something that there really is that economic impact that we may not be thinking about. So this is my segue into talking about COVID and the economy in the future. So in this conversation that we're having of, you know, what does a post-COVID world look like? Is there a way that we can sort of slide this impact of trauma into that and say, you know, as we remake the economy, we need healthy workers. We need workers that aren't traumatized to be effective and the most productive workers. And so there's an obligation collectively for us to pay more attention to this issue.
Yeah, I completely agree. I mean, the way I look at it is we've transitioned in what you were just talking about. We've transitioned into calling these people immigrants. Now we're calling them workers, employees. So, I mean, even just that language, if this if this whole time was discussing, do we want employees who are healthy or not? It should be a very short seminar. Or do we want people who are sick or not? I mean, so I guess one is, if you think that a huge amount of the trauma or the COVID-19 comes in terms of productivity costs, that only happens if the people are productive, right? So you can think about this just in terms of how do we want our economy to work, or how do we want to treat sick people just in general? Is there some way we feel comfortable about it? And so to me, it seems that way of framing it takes us in an interesting direction, because we've switched the label to be about people who are producing something the economy finds valuable. I'm not saying we should view people this way, but the moment you switch it to that kind of discussion, it seems even more difficult to deny someone who's sick care, or to deny someone who is helping make goods and services that you value. It seems harder, because it seems like we may be more integrated in that way. Someone else's welfare might be linked to my welfare in terms of what's good. So those are the thoughts that come into my head when you're talking about that.
And Tanya, let me take that one step further. So there's this argument that's being made in the post-COVID relief packages that we expect that there will need to be additional legislation and additional federal funding at least, and really trying to frame immigrants as essential workers, as important to our recovery, not just our continued day-to-day life that makes, as folks have pointed out, that gets us our food, that are still driving the buses for the people that need to take public transportation, working in meatpacking industries and farms. So talk a little bit about how, as long as both COVID and the long fight back to economic recovery will happen, that immigrants are really going to be important.
Well, I mean, I think the first point is just the point that many people have made already, especially we've known this in California for so long. It's not like immigrants live isolated all by themselves out here and citizens are over here. We live together in families and communities. We depend on each other every day, and our health is interconnected and our recovery is interconnected. And so it goes beyond, and whether it's somebody who's, essential day-to-day to making sure we, can eat and have health care, or whether they're kind of coming up with a vaccine that's going to cure us. I mean, I think we can't live without each other, and we're dying right now. So I think it's literally a life or death moment when all the things that we've known about for a long time have been kind of exposed, and it's really time. And I guess what's given me heart is that, and some hope, is that we are having the conversation in a more serious way than ever about the need to cover everybody on the healthcare side, about the need to support each other economically. And even at the federal level, there's been the kind of debate that I wouldn't have seen earlier across the bipartisan divide about the need to support mixed status households. So I do feel like we are advancing that conversation, even as we're facing the biggest crisis ever in my lifetime.
And Cynthia, both you and Tanya also referred to the other sort of crisis of the moment in our time of, after George Floyd, our national increased consciousness of racism, of anti-Blackness in this country, and how that has permeated so many of our institutional structures, the opportunities that Blacks have in this country or don't have. So talk a little bit about then centering this work around racial justice in this broader vision of what our society that includes welcoming and integrating immigrants looks like.
Thank you for that question. I can only speak to the process that my organization is now going through because we are literally right now engaged in a deep conversation around not only what deep solidarity with Black lives look like, but really how do we embrace the lessons of the last few months as the racial issues that have come up really brought home the fact that our system is broken, right? That there really is we need to make an attempt to make a serious break with the brokenness of those systems, but it has to start somewhere. And for us, it's thinking deeply about, everything from the language of our handbook, how we hire, what is the kind of hiring tool that we look at, right? How are we anchoring our mission in the knowledge that there is no true, I'm going to use these lofty words, freedom and liberation, if we don't recognize how tied our communities' histories are with the history of slavery and racial inequity in this country. And it's a very tough conversation, because as civil rights advocates, we have made these assumptions that we were already people that fight for this issue, right? Or that as an organization that has been working on immigrant rights for 23 years, that we were a racial justice organization. But as we have engaged in this learning process, we're learning so many new things that is revealing to us many ways in which we can center the lives of Black immigrants, for example, as an immigrant rights organization, how we can share resources with our partner organizations that are Black-led, how we can also just make sure that we are resourced as an organization to deal with these changes that we're going through. It starts small, but it's sincere, it's decisive, and we will hold ourselves accountable to that commitment. And as I said, I'd rather speak authentically about that than, make sweeping statements about how we're going to do this, because to my point earlier, it's not easy, especially when you are also being asked to lead at a very difficult moment. Your communities are experiencing several crises at the same time that are compounded, because those family separation policies, they didn't start in 2016. They started way back with millions of people that have been deported. So it's just like using the lens of complexity, grounding your organizational values in racial justice, and making a unique, sincere effort to realize it in your organization and how you talk to your partners about it.
And one other connection that I see, if anybody wants to comment, is, we've been talking through the symposium about trauma, and a lot of that trauma is caused by enforcement activity, by immigration and customs enforcement, and by Customs and Border Patrol. And I think just as the conversation about policing, and are there alternatives to policing? Are there other ways that we can use the resources that we put in policing and mass incarceration to actually make our communities safe, rather than using an enforcement philosophy? I think that's the same thing, that, are there alternatives to immigration enforcement that are not punitive, that are not about mass incarceration of immigrants as well? So if Tanya or Cynthia want to comment.
It's, what can I say? It really aligns with all the things that we've been working on for all of these years, and it's time for us to do it. I think, there are fiscal groups that have documented the cost. You don't need it, but have documented the cost of detention. Now in the face of COVID, when people are literally, there's no reason for people to be incarcerated, and to give each other and the people who come in and out of the detention centers sicknesses, when we could take that money, when people could be with their families, supporting their families, moving forward, whether it's in the immigration process or whether it's in the kind of returning to communities process, and everyone's going to be better off. And I really respect all of the work that other people have been looking at for years, and that can come out now and be implemented now on restorative justice, on alternatives, whether it's in the schools or whether it's in the criminal justice system, to try and find ways to do better and help people have true opportunities to succeed, to thrive in our communities together. And as we've talked about before, it's only going to benefit all of us. It's not really going to be an individual solution. So I'm excited to see this work kind of come to fruition, and I really respect all the people who've been working on it for decades.
Ignatius, I just wanted to add, Tanya named broad strokes responses, and that includes really reforming our immigrant and criminal justice systems. But one thing that I do want to flag from working in other parts of the world is we should look at some of the models of community-based reconciliation and restorative programs in West Africa, in Southeast Asia. I mean, I work in East Timor after the independence movement there, and they have a very good model for how you deal with conflicts and tensions in society around violence and rule of law. So I think we as a country who pride ourselves with a lot of expert knowledge and a host of big issues have a lot to learn from other countries who have actually successfully done this, including case studies from Rwanda and Uganda and in other parts of the world.
So Jeff, there's a point in the chat which you responded to, but I just wanted to give you the opportunity to articulate that sometimes we also forget the cost of not doing something, of not taking into account and just sort of going with the status quo. And that's the way the system is always run. And I think we're having that conversation exactly about some of these things like policing, that, you know, just putting more resources into police is the solution, as opposed to really stepping back and thinking about other alternatives.
Yeah, another way to look at that, if you wanted to draw a picture, remember, some of you may have been awake even that far into my talk, there were 2 dots that I connected with a yellow line. You can't connect the 2 dots to look at the slope if you're not looking at 2 things. One thing could be usual or standard practice or whatever, and the other one could be this new thing you want to try, but you can't draw the line if you're only talking about the cost of the new thing, or if you're only looking at the effectiveness of the current way of doing it. It's the type of ways that I know of showing value involve comparative investigations, where you look both at the extra cost and the extra effect, but you can only do that if you're comparing one to something else. And if I might add, you can always make something look attractive by wisely picking the comparator and saying, I want to pick this or choose that. But it seems to me, if we're talking about changing what we're currently doing, then starting with what we're currently doing ought to be a good starting point, and then just saying, can we do better?
Great. So Cynthia, let me go back to you. I really love the notion of no going back. That again, I've written about this as well, that, you know, a lot of people say, let's go back to, you know, pre-COVID times. And many of us are saying that was not a great system. That was not a great time. There wasn't fairness and opportunity and equity. So let's reimagine a future that's very, very different. So say more about what that future looks like and how all of us can work towards that very, very different future of not going back to the awful way that things were.
Yeah, and actually, I want to make a little plug for a report that is exactly that title. I was part of a committee for Greater Los Angeles that drafted a report called No Going Back. And I'm going to share the link to that website, because it's like a more than 100-page report done with UCLA and USC that really looked at what was the before, now, and after. And I think, you know, specifically looking at immigration issues, because we covered the entire spectrum of systems and infrastructures, because that was what we did, was we looked at vulnerabilities, right? Like we created a vulnerability map with everything from geographic location, education, youth organizing, housing access, access to economic and business opportunities. So it's a big report. But on immigration, I think when we say no going back, it doesn't mean that what we built doesn't matter, right? In California, as I said, we have progressively moved from the time of Prop 187 to now, where we're aiming to provide as inclusive a system as possible that's accessible for immigrants. But what remains, of course, is this 2 system of existence, where the rest of the California population can have access to healthcare, whereas, you know, we will have to work so hard. It took us 5 years to cover young adults and children under medical. And, you know, and if you connect that with the immense role and contributions that immigrants play in our state, it's significant. So that, right, like let's dismantle this two-tier system of justice, of access to the safety net, because we've learned it's doable as long as whatever is feasible in the state can be done, because we know that we will always run into preemption issues, and that's where we have to work hard to fix our immigration system. But what's doable in California has yielded significant quality of life outcomes and social determinants of health outcomes for many immigrants. So we can't, you know, as I said, we can't go back to the way things were, because we knew they weren't working. And these are some baby steps, because they're not going to be done in a year, especially when we're dealing with an economic recession in California. But the big, bold ideas have to start now, because people are struggling with what to do. At the end of the day, we've been saved by our need to respond to emergency, but we will not be in emergency mode for a long time. And that's where a lot of the hard work has to start, is this rebuilding. What is that? Is it a 10, 20-year project? I don't know, but we're starting with a rethinking of law enforcement. That's amazing. That is no going back. You know, we want to start with challenging Silicon Valley in providing digital access to everyone in California. Like, you know, can we advocate for something like the rural electrification project of years ago, where Wi-Fi is not something where families don't have access to it, so their kids can't go to school. So these are, you know, it's a big conversation. We are willing to have it with you, but it starts with making sure that we're committing to not repeating the broken systems of the past.
Great, thank you for those inspiring words and that call to action. So if we were live, I would ask everyone to join me in giving the panel a great round of applause. So we'll have to do that virtually. And let me turn it back to Dr. Aguilar-Gaxiola.
Well, thank you so much, Ignatius, and thank you to the panelists for those wonderful presentations and the exchange of you know, information, ideas, and also to the attendees for providing with your questions. We are very grateful to all of you. And now for the closing remarks, I'm inviting Kara Carter to please help us with that. Kara?
Thank you, I appreciate it. It's a daunting task to try to close or wrap up what was, I think, a very interesting, very informative seminar. I certainly learned a lot. I'll start by thanking everyone for joining us today, all of the participants that we've had here, as well as our panelists. And to say, for me, I'm struck by two things which I think underpinned the conversation that we had throughout the afternoon. The first, if we go back to where we started this series of seminars around adverse childhood experiences and ACEs, I'm really struck by, in addition to the traditional ACEs that we've studied and we've seen, the sort of everyday uncertainty that faces immigrant families, which compound the ACEs that have been well studied. Things like not being sure, you know, where you can go in the future for support and help, and being uncertain what the public charge means for you, public charge rule might mean for you, or the impact of family separations, or many of the immigration policies that we've heard of. And the other thing that for me really underpins the conversation is the layer or ways in which the COVID-19 crisis has really laid bare the inequities that we see with the, you know, both the disease and the economic burden being borne disproportionately by Black and Latinx communities in California. So I want to thank all three panelists and just pick out a few things that I heard. So, you know, first, really extend my thanks to Dr. Hotch for making health economics accessible to all of us and, dare I say, fun. Deeply appreciate that. And I particularly appreciated the connections that you made between ACEs and the immigrant population, and helping us understand the complexity of the decision-making process that policymakers encounter when they're trying to weigh up what can be seen as cost-benefit analysis, but can also be seen as the drivers of real improvements to the lives of individuals and the communities that we live in. So prioritizing interventions, as you helped us understand, is really difficult and really, really hard. And giving us the framework for accountability and how decision makers weigh things up, I think, tremendously helpful as we move through the rest of the seminar. To Tanya Broder, I just really deeply appreciated you reminding us of quite how expansive this administration's immigration policies have been and how widespread their impact. The idea of an invisible wall of administrative policies was new to me. It may not be new to most of you, but to me it was new, and certainly a visual that I will take with me. Incredibly impactful way of describing the problems that we're facing. But I also think it's easy to forget how much is in our individual ability to control. And so I also appreciated you reminding us of things that the state, health and social services providers, and indeed us as individuals can do, and the power of our individual and community voice when used and deployed in collective ways. And finally, Cynthia Buiza, thank you for bringing a vision of hope to us as we wrapped up this thinking, reminding us both of the long list of things which California has achieved, as well as a reminder of the work that we have to do to get to a safe and equitable future for all Californians. I deeply appreciated the honesty with which you approached the complexity of the need for us to all address anti-Blackness and the intersection with the history of intertwined oppression in the US. I think that was very thought-provoking for us, both as you reflected on your own institution and the work that we all have to do as we try to drive towards greater health equity across the board. So when I look back at all three symposium, if there was one thing I was going to take away, it would be this, that the concept of trauma is a really useful way to understand the complexity of cumulative experiences that are affecting immigrants and immigrant communities at large. So rather than taking on, one by one, the individual impacts of policy or day-to-day life, understanding that these are communities experiencing trauma at its broadest, and that has an impact at the individual, the community, and the broader society level, for me, incredibly helpful. And I think the symposia also provided me more information on how providers, individuals, and systems, what they can do. So how they can stand up and respond to that intergenerational trauma. So I want to really thank the Center for Reducing Health Disparities for pulling us together and creating this opportunity for shared learning. And particularly want to thank Dr. Sergio Aguilar-Gaxiola for bringing us together and convening us, Ignatius Bao for moderating our panels, and our three panelists for just bringing a tremendous wealth of knowledge and expertise. So on behalf of the California Healthcare Foundation, thank you all for joining us.
Thank you so much, Cara. We really appreciate your participation and being able to integrate and to comment on topics that are certainly related but challenging. And I was impressed, positively impressed on how you were able to do that and comment on the highlights of the presentations, the information presented by the three panelists. So thank you for that. And amazing, but this concludes our three-part symposium series. We are grateful to all the speakers, the panelists, and moderators, the teams that made the symposium possible, and those who attended the series and contributed with your questions and resources. There are a lot of resources that were posted in today's symposium, and we will be able to extract them and to create a list of what was shared. So thank you so much for that. Our gratitude also to Dr. Sandra Hernandez, the president and the CEO of the California Healthcare Foundation, and Kara Carter, who just provided, once again, the closing remarks. As mentioned at the onset of this program, we will be writing and publishing a report based on the recommendations of our experts. And also, you know, the comments that we have gotten from the audiences that had participated. This will be made available early next year, the report. All registrants from this symposium will receive an email alerting you that the report is available. Please check our website, and you have it on the slide, and you are going to find you know, recordings on our website for all the 3 sessions. And just finally, all registrants will receive an email informing them when part 3 is available. Parts 1 and 2 are already available on our website. In the coming days, all attendees will receive an email from Qualtrics, which is a web-based survey tool with a link to evaluate today's session. Please take a few minutes to complete the brief survey. It's gonna be very helpful to us if you do. And once again, thank you all for joining us today. Take care and stay safe.